So we can proceed with our next presenter. And this is Hiroshini Amarasinghe with her presentation, Evaluation of the Effects and Efficacy of Treatment Protocol in Management of Overweight and Obesity. And Madam Hiroshini Amarasinghe was supposed to join us from Sri Lanka, but since we have also the pre-recorded video of our presentation, I will play it now.
Hello, I'm Bowan from Sri Lanka. I'm Dr. Hiroshini Amarasinghe from Sri Lanka. I got my bachelor degree and master's studies in the University of Kelaniya, Gampaha Wickramarachya Ayurveda Institute. I'm a consultant physician, Ayurvedic physician, and yoga and mindfulness coach and acupuncturist. Right now, here I present today my master's study thesis. Topic is evaluation of the effect and efficacy of the treatment protocol in the management of overweight and obesity. My supervisor is KGZ Disanayaka, senior lecturer in Kaya Chikitsa, Wickramarachya Indigenous University in Sri Lanka. Overall, the background, I don't need to go more in details. Everyone knows what is the obesity and current scenario and everything. Obesity and overweight has a huge impact in the society, even from childhood to the adult. And here is some significance. You can see it. And here, this aim, my aim is an objective I like to introduce. The general objective is this study is evaluate the effect and efficacy of the treatment protocol in management of obesity and overweight. Specific objective is effect of the selected herbal formula on the serum level of cholesterol, body weight, and the blood sugar level, blood pressure, body circumference, and skin fold thickness. Hypothesis is the treatment protocol is effective for the management of overweight and obesity, or the treatment protocol is not effective the management or overweight of the obesity. Literature review. Here is explain slide by slide about the what is obesity, what is the definition and everything. I'll get more definitions from WHO websites and documentations followed up. Here in obese and overweight classify as a BMI number above the 25. And obesity and overweight explain more than in details here. What is the factors, why these are important as a health practitioners. In literature, we recognize physical activity, less physical activity or behavioral effectives and dietary regimes, pharmacotherapy or surgery we can suggest as in generally. But according to the Ayurvedic physician, I need to introduce an explanations about the obesity or clarified what is in Ayurveda the way. Medoroga or Ustaulya, it is the meaning of the obesity or overweight. It is mainly Vata dosha, Pitta dosha, and Kapha. Vata, Pitta, and Vata, Kapha, and Meda doshas differentiation and effects of the body can get the Medoroga or Ustaulya. In Ayurveda literature, explanation about the Ashtaninditiya Adhyaya. It means there is 8 different characters of persons. It's not good. It means Atisaulya. It's overweight person, not recommended in Ayurveda. And also pathogenesis of Ayurveda, complications, all the things explanation. But when I do the master studies, our main object is we need to find traditional Ayurvedic formulas in the society or in the old leaves or in the books. It means a traditional formula or Ayurvedic formula, and we need to arrange the protocol and check these medicinal formula is effective the particular disease. I got the Ola Leaf manuscript. I found this from the one of Buddhist monk from Haliagoda Dhammapala Venerable. He is a mental disease physician, traditional physician, and I'll find the formula of this Ola Leaf manuscript. Then I'll review this formula with my teachers. It indicates these ingredients: Apasumadu, Frigidia fortifolia, Enderomul, Resinus communis, Yunguru, Singibu officinale, Konlu, Bilicosus bilifoli, Kuburu atta, Madhangu, Murunga potu, Rapnetol. These are the 8 ingredients to prepare this special decoction or kashaya. I like to introduce my methodology of the research. I take the 2 groups and with the dietary management and give to the vegetarian diet and use the herbal decoction. 2 groups included this with one group with the only decoction, the second group with Panchakarma treatment plus this decoction. I got all the patients from voluntary patients from the obesity clinics of both Ayurvedic hospitals, Pusalla Ayurvedic Hospital and Molligoda Ayurvedic Hospitals in Sri Lanka. All the included criteria with 30%. The clinical settings, the group 1, group A, given only the decoction, group B, given only the decoction and purgative formula. Inclusion criteria, I'll check with the body weight and BMI, then I categorize to get who I get. With all the 20 to 60 years, and exclusive criteria is who has a serious cardiac problem, myocardial infarctions, cardiac failure, hypertension, pregnancy or breastfeeding mother who has suffered a long time with the different kinds of physical illness. I'll check the measure of the weight with the weight balance, regular balance, and a part of that BMI I use BMI calculators, and I measure the skin fold thickness of all patients before the treatment and after the treatments. Even the waist-hip ratio too. A part of that, I'll do some hematological investigation, the fasting blood sugar and lipid profile. I use accurate collaborated labs related who work with the hospitals in Ayurveda. Preparation herbal formula. This is the recipe of this decoction preparation. Ratnitol is a Plumbago indica. We need to purify before the procedure. Here is this. And dietary management, monitoring. I'll have a clinical settings with who admitted the hospital for the Panchakarma procedure, and then I'll start with the medicine decoction procedure. Here is the result analysis. Age-wise distribution, age-wise distribution, you can see marital state distribution, number of children, number of education level, religion-wise, this. All the 2 groups are quite similar, 99% similar. And then I'll go to the check with the BMI and weight. Before BT means before treatment, AT means after treatment. Weight and BMI. Here's the significance. I'll analyze the data with SPSS systems, paired and independent paired sample t-test and independent sample t-test. The body circumstances and skin fold thickness, blood sugar, finally, I like to go through the discussions regarding to this weight and BMI. After all the procedures, because 21 days decoction only with the group A and the group B, Panchakarma procedures for the 7 days, Achapana and Vireka, and after that 5 days Achapana and then 1 day Vireka, and then after the 21 days decoction procedure. Both groups significantly reduce their weight. But when you compare with the A and B, the B group has increased, number of patients are increased than the group A with the positive result. A patient with the group A and B significantly show decrease the weight and BMI level comparison to the level of the same parameter before the treatment. According to that, medicine with the treatment as well as only the medicine better to reduce the weight and BMI. A purgation procedure and herbal formula effect of the management of weight and obesity. After the Deepada Pachana Snehana procedure, we apply the Virechana and then go to the herbal decoction treatment. Herbal formula, especially Moringa, Kollu, Inguru, are there very effectiveness with the reduced weight. Body circumference, skin fold thickness data indicate different superscripted letters. You can see the changes. Fasting blood sugar, not much, but they also reduce. Lipid profile, some of them reduce their lipid profile very good. Some of them little bit increase with the LDL level. But after that, the whole procedure is finished, like 21 days and Panchakarma plus 21 days. And after 2 weeks, I'll check with the cholesterol level and the blood pressure, blood sugar, they are normal. Conclusion of these studies. It was hypothesis that management of overweight and obesity control collaborated with the Kashaya or decoction with the Panchakarma procedure. Despite having has related large number of patients, we need to compare. Because I used to these studies for the 60, but I need to arrange with a large number and the different area of the Sri Lanka, I can get more better results. I hope so. I plan to develop this research in future. The result of the BMI value decreasing, which evaluate the management of overweight and obesity shows. And hypothetically, it says proved with this result, and also cholesterol. The group B and group A both to reduce LDL cholesterol, skin fold thickness, waist circumference, bicep, tricep, subscapular, superiliac circumstances, and skin fold thickness. As a result, it's significantly that there was a visual normalized difference of the patient who were treated along with the Panchakarma procedure. In the meantime, it was highlighted that the participant more enthusiastic and complete the treatment procedure when they are related along with the Panchakarma procedure. Some of patients not reduce the total cholesterol and triglyceride level. Then after this research period, I'll continue with them the Gokshuradi Google plus dietary regime like the vegetarian meals. They are after the 2 weeks. It means after total 21 days plus Panchakarma 7 days is meant 28 days, and after 2 weeks, and then after again 2 weeks, like 14 days and 28 days. After that, I will check all the patients with the blood pressure, cholesterol, and fasting blood, all are very good result. Here is some recommendation regarding to my presentation, and hopefully you get the idea about my results and everything. Thank you so much. Here is my working place. You can visit it. Thank you. Ayubowan.
Okay, let me thank Dr. Ms. Hiroshini Amarasinghe for her presentation from faraway Sri Lanka.